Okay, so taking care of your teeth, it's something most of us do every single day, but are we actually doing it right? Today, we're going to dig into how the right dental habits are way more than just a chore. They are absolutely crucial for your overall health.
So let me ask you this. You brush every day, you might even floss, sometimes, but are you really being effective? Or is it just that same old muscle memory you've had since you were a kid? Because what we're about to go over might just completely change how you think about that daily routine.
Right. Let's get into the nitty-gritty. A truly healthy mouth isn't about scrubbing your teeth into submission. Nope. It's about using smart techniques and building habits that actually work with your brain instead of fighting against it. First up, let's talk about what's really at stake here, because I promise you, it is so much more than just having a pretty smile for your next photo. Your mouth is basically a window, a direct look into the health of your entire body. Think about it for a second. What could bleeding gums possibly have to do with your heart? I mean, they sound totally disconnected, right? But this is actually a perfect way to understand what researchers call the oral systemic connection. And this is where things get really serious. See, the bacteria and inflammation from gum disease, they don't just stay in your mouth. They can actually hitch a ride into your bloodstream, and that contributes to a pretty shocking list of major health problems. We're talking heart disease, diabetes, pregnancy issues, and there are even links to Alzheimer's. So the takeaway here is undeniable. A healthy mouth is a non-negotiable part of having a healthy body. Okay, so we've established why this is so important, but what does a really effective routine even look like? Let's break down the actual mechanics of what it takes to get your mouth properly clean. You've heard this from your dentist for forever, and there's a good reason for it. 2 minutes. That is the scientifically backed absolute minimum time you need to effectively clean all the surfaces of your teeth and break up all that plaque that's trying to build a home in there. And now for the reality check. Are you ready for this? Studies show that most of us brush for only 30 to 45 seconds. That is less than half the time we need. It means we're leaving huge parts of our mouths totally neglected every single day. And get this, even if you're one of the good ones who does brush for the full 2 minutes, your toothbrush alone literally cannot reach about 40% of your tooth surfaces. That's all the space between your teeth. And that right there is why cleaning between your teeth isn't some optional extra. It is absolutely essential. So knowing what to do is half the battle, but actually doing it day in and day out, that's the real challenge. So now let's dive into the psychology of how to build habits that actually stick. You ever try to change how you brush your teeth, only to find that a few days later you're right back to that old side-to-side scrubbing motion? Well, that's not you failing or lacking willpower. It's a real psychological thing called proactive interference. Your old automatic habit literally gets in the way of learning the new, better one. Your brain just defaults to autopilot. So to beat that, we have to build a new autopilot system. And we do that using the habit loop. It's this 4-step pattern our brain uses for every single habit. It starts with a cue, like seeing your toothbrush on the counter. That triggers a craving for that clean mouth feeling. That leads to the response, which is actually brushing. And finally, you get the reward, that fresh, minty satisfaction that tells your brain, hey, that was good, let's do that again tomorrow. And this right here is why habits are such a superpower. Look, motivation is flaky. It comes and goes. We all have days where we're tired or stressed or just not feeling it. But a solid habit, it doesn't need motivation. It's automatic. It just happens. It makes sure you keep doing the healthy thing even when life gets in the way. So how do we start building that new, better habit? It all starts with having the right tools for the job and using the right techniques. Let's build out your perfect oral hygiene toolkit. Okay, this right here is a total game changer for most people. On the left, you got the classic scrub method that probably 90% of us do without thinking. But on the right is what the pros recommend, the modified Bass technique. The key difference is that 45-degree angle. You point the bristles towards your gums, which lets them get just underneath the gum line where all the nasty plaque loves to hide. It's way more gentle and way more effective. And now let's talk about that 40% we mentioned earlier, the space between your teeth. The absolute best tool for cleaning in there is the one you'll actually use every day. Simple as that. Interdental brushes are fantastic, especially if you have bigger gaps. Good old-fashioned floss is great for really tight spots. And water flossers can be a lifesaver if you have braces or find the others tricky to use. Just try a few and see what feels right for you. And of course, we can't forget about technology. Modern smart toothbrushes are basically like having a tiny dental coach in your bathroom.
They connect to apps that give you real-time feedback on where you're brushing, if you're pressing too hard, and they can even make it a fun game. This kind of tech is brilliant for turning mindless brushing into mindful, effective cleaning. But a great routine isn't set in stone. Your body's needs change throughout your life, and your oral care has to change right along with it. Let's touch on a couple of really important life stages where you need to adapt. There's this old, stubborn myth that you should avoid the dentist when you're pregnant. Well, as this quote from the American Dental Association makes crystal clear, the exact opposite is true. Pregnancy hormones can actually make your gums more sensitive and prone to problems, so getting professional care is more important than ever. It is perfectly safe. And this gives some fantastic practical advice. That last point is so important. If you brush your teeth right after being sick, you're basically scrubbing stomach acid directly into your enamel. Yikes. A much better move is to rinse with a bit of baking soda and water first. That neutralizes the acid and protects your teeth from damage. As we get older, things like dementia can make daily oral care incredibly difficult, not just for the person, but for their caregivers too. This quote from a dental hygienist who cared for her own father with Alzheimer's really hits home. As cognitive abilities decline, the simple motor skills needed to brush and floss can sadly fade away. For caregivers in this situation, a technique called tell, show, do can be a lifesaver. It's a really simple, gentle approach that can help reduce a lot of the confusion and stress. You just tell them what you're about to do, you show them, and then you gently do it. It breaks a really tough task into small, manageable, and much less scary moments. So, as we wrap things up, let's bring it all back to the main idea. This isn't about trying harder or feeling guilty for not flossing. It's about building a better system. It's about understanding the psychology, using the right tools for the job, and creating a solid habit loop that makes great oral hygiene an effortless and automatic part of your day. Let's end on this note. To really make a change, you have to start somewhere. So think about that habit loop. What is one small, simple cue you can set up tonight to kickstart your new routine? Maybe it's just putting your floss or your intradental brush right on top of your toothpaste tube so you can't miss it. Whatever it is, make it simple, make it obvious, and start building that better habit tonight.